Welcome to Breast Cancer Answers. We are so excited to be here today. I have a special guest in the house, Sherry Zumbrunnen. She is a board-certified holistic nurse, and I've met Sherry, had the pleasure of meeting her over 4 years ago at a party, and I come to find out that Sherry worked in oncology at the Virginia Piper Cancer Center in the Mind Body Healing Program. And I asked Miss Sherry if it would be okay if I could come over to the cancer program to see what goes on there, because I was very intrigued with the whole science behind cancer and the treatment programs, especially in integrative medicine. And so come 3 years later, myself gets diagnosed with breast cancer, and now I'm taking part in the amazing program that Sherry had put together for Mind Body Healing. Sherry, welcome to the program today. Please tell our viewers about your background.
Thank you, Wendy. It's good to see you, and it's good to see all of you out there. I'm a nurse, and actually I worked in ICU for about 17 years, and I really noticed how people were doing, with the same diagnosis. They came and they went, and some did better than other people. And I think it was a lot to do with how they felt about themselves, what was going on in their environment, and so on. So I learned a lot there. And then through my practice, I became a holistic nurse. And then when the Cancer Center opened, I was invited to start the Body, Mind, Spirit program as a holistic nurse, a whole body, spirit, and mind incorporated. So it's something that is very integral to us as a person, but sometimes we forget it. And so when a patient would come in to see me, I would think of that term that, you're diagnosed with cancer. That's huge. It has a huge effect. And so I would remind them to remember who they are, and to stay who they are, and know who they are, that they are not the diagnosis. And that's the holistic approach, that it's a continuum. And the continuum is not that you're healthy on one end and then you're diagnosed with something on the other end or have a disease. It's that you are in the center, and you're always in the center. So really, that's how the program developed. We had a lot of therapies, different therapies, to go along with that.
And I remember having a wonderful therapy with you of just talking about going through a list of questions about mind and body. And you asked the questions, and you had me allowed myself to dig deep into my persona of what is it that makes me happy? What is it about my life that keeps me going and inspires me? And just by talking through those questions, I left feeling more integrated and whole, and knowing that I was on a better path than what I thought I was. I had less depression than what I thought I had, and I just by how you geared the questions, and then the yoga class and everything else that was there, I really felt it was such a special place for healing. Now, Sherry, what would you share with our breast cancer survivors as some of the most important tools to be able to utilize on their journey to holistic healing?
When I set up the program, it was very important to do therapies and tools and treatments that actually were research-based. The yoga is research-based. It definitely works. It does relax the body. It gives you a focus. The things that really work well is for you to be in the moment, to be present. And it's Qigong, Tai Chi, yoga, walking your dog, exercise, whatever it is, if you're in that place at that time and being aware of your surroundings, that's being mindful. So we use the mindfulness probably as a key component. So even in yoga, being mindful of your body, even yoga, sometimes, we want to do our best and so on, and we can hurt ourselves. You want to listen to yourself. As Wendy said, once you stop and kind of identify with who you are and how it works for you, then that is the best way. Not what I tell you, not what someone else tells you, but when you stay still for a moment and drop inside, then you'll kind of know who you are and what's good for you. And so the therapies are that, what you choose and what will work for you. Not everything works for everybody. So it's something that resonates with you, whether it's music therapy, art therapy, just sitting down in your home on your sofa and turning on some quiet music, those kind of things that really resonate with you and that gets you to know yourself better. I feel it's a time when you get a diagnosis that, okay, it's time for you now. It's time for you to take a moment to be with you, to see what nourishes you, what keeps you whole, holistic, right? Because nobody else knows that, just you. And so take this time as an opportunity. That's what I invited my patients to do, to take this opportunity to be with you, to find out what you like, what does really resonate with you, what does nourish you, what does help you. And then you will choose that. And so as you go on your journey, treatment, whatever it is, you can stay with that. That gives you your power, a chance to take that power for yourself, because it's very difficult. You're busy. You're going places to the doctors. You're having all these appointments. You're doing treatment possibly. And in that process, you kind of feel like, wow, I have no control. But if you do, and take that control and take that essence of your being and say, you know what, I want to enter into this. I want to integrate myself in this process. So I feel
Sherry,
that's really works well.
that's very well said, and you reminded me at that time that I had my biopsy and had to wait the whole weekend to find out by Monday what the diagnosis was. I will say everything stopped. And it was a really good feeling, like the spinning top of life of everything that you thought was important no longer was important. There was a huge shift, and in that shift there was a pause. And I think that's when I really turned into, okay, arriving in the present moment, I have to take each step one by one in bite-sized pieces so it doesn't become overwhelming, because I did have an inkling that something was wrong. And so it was the being able to slow down and pause and integrate what I might have been missing all along. So I really appreciate that. Also, being so fortunate to have the Virginia Piper Cancer Center in our backyard in Scottsdale, Arizona. How do others find cancer communities or cancer centers that help work with the integrative approach to mind and body?
I think that the same thing as how you pick your physician, how you pick your team, uh, is all well-rounded. And again, once you kind of sit with yourself and figure out what you need, then you go out, because once you identify it, I really believe it shows up. You can go to your community. There's a lot of physicians that actually know some different members of their team that are integrated. Acupuncture, for one thing, helps great with nausea, vomiting. It's research-based. I've seen it work well for people, a lot of people. So again, it's whatever works for you. So looking out in the community, go on the website, go and find what yoga class, interview the teachers, see what they're about. Maybe it's not just the exercise, but also that, again, whole picture, that I want to feel comfortable if I don't feel really well about going, go ahead and go, be there. If you don't feel like doing something, feel comfortable that you don't do it. That's really, I think, important. So I think you can find those places in your community if you're willing to kind of look and take the time. And maybe not you, but ask friends, other survivors, maybe join a group. A lot of times they'll know some of those classes and so on. So I think there's a lot of things out there and a lot of areas that you can look into.
Excellent. And you've touched on this already, Sherry, but can you explain to our viewers, people that are more independent in their own healing and such, how the role of community is important for supporting something such as cancer?
It's very important. As I sit with patients and their families, I've noticed that a lot of times families feel very inept, right? They don't know what to say, what to do, because it's not them, right? And they love and care for the person that they're with. So again, maybe they're not the best all the time for that support. Maybe a good friend, somebody that's had cancer before, particularly breast cancer. kind of feel that out. You know, when you go to your doctor's office, when you go to your treatment centers, figure out what again resonates with you and the person that resonates with you, and maybe make friends, because again, you're not alone. You know, we're never alone, but we feel alone, especially in that original diagnosis. It can't be me, it's not me, and so on. But you know, if you drop into, you know, it is you, it's always you, and it's okay to be you. And again, that's where you want to be. So you can be that you to that other person, and they can be that to you, and a great support for you emotionally, spiritually, in all aspects.
And sometimes I feel it's harder on the caregivers than it is, at least for me personally, because I knew where my mind was, I knew where I needed to keep it and what inspired me. Yet my loved ones that were supporting me didn't know how to cope. And I can relate to that, you know, coming from the other end of being healthy and others that were going through other issues. And I know that the Cancer Center is so wonderful for supporting family members. I took my mom to a drumming class over there, and she just absolutely loved it. She's like, where in Michigan can I find drumming circles and just be able to, you know, get it back into the rhythm of life? So I got to see how it really spread out here in Scottsdale, Arizona at Virginia Piper Center, and being just such a wonderful, intricate community. And here we have Sherry. And Sherry, I'd love for you to talk a little bit more about mindfulness and how mindfulness and perhaps a breathing exercise can help when you're sitting in the waiting room or getting ready for a diagnostic test, where our minds can be a little bit of a, I like to say, an untamed puppy. You're trying to pull it back on a leash, and it's so curious of what's going on up in here. And if you could share with myself and our viewers of an exercise that we could take with us wherever we go.
Absolutely. You know, I teach at ASU now and teach relaxation techniques or stress management tools, actually. So, and mindfulness is one of those tools that really works anywhere, anytime, being in the present, because our mind has a tendency, that mind part that we, you know, that's a part of us, the mind, body, and the spirit. The mind part has a tendency to jump into the future and the past. Well, what's going to happen to me? What's going to happen in the future? Will this cancer come back after my treatment? How about past, the memories of, you know, who I was and what I did and so on, and the concepts that I had of me, so on. So if you stay in the moment, you're okay, right? I'm okay when I'm in this moment because everything's fine. So being in the moment is difficult, but you can stop for a moment and take a breath. So if you're in the doctor's office, for instance, and you're waiting for to see him or her, or you're waiting for diagnostic results, then just sitting with you and your breath, just watching the breath. You don't really have to do anything in the beginning. Just sit with the breath. Just be aware of it. So you're sitting in the present moment, being aware. And then the third thing is to be non-judgmental. Okay, that's difficult, right? Because we have a judgment for everything, not good or bad, but we just do. And so in that moment, just noticing what the mind says, noticing that the mind is not always right, right? We kind of learn that, I think. We kind of think it is, and then we kind of learn that it's not always right, right?
Don't trust it always.
Yeah, I don't trust it always. Trust yourself. Trust that inner, that essence of you. So when you're sitting there in the doctor's office, for instance, just take a breath. Just, and all of a sudden, you're in the moment, right? You're there. You're within you. So let's do a little exercise, if you will. It won't take very long, but I'm going to take Wendy through this exercise specifically, and I want you to join us if you would like, or just observe, whatever feels more comfortable to you. So closing your eyes for a moment, just being aware of the sounds, being aware of the sound of my voice. So you're being present. And then watching the mind come through. Kind of like clouds in the sky, just observing. They come, they go. And that's something that happens with us. When we're in the moment, maybe some things seem a little tense, but that can change in the next moment. Everything changes all the time. And we can count on that. And actually, it's a good thing. So feeling the breath come and feeling the breath go. And then scanning the body a little bit. Just allowing your mind to go to the feet. Then maybe the ankles, your legs, knees, thighs. Nothing to do about them. Just taking notice. Notice the hips. Notice your spine. Notice the soft belly. And then notice the lungs. You know, the lungs have that intelligence to breathe on their own. So you can trust that. Let it happen. Without any effort, effortless. And then your heart. The heart also beats on its own. It's automatic. It has that intelligence. So allow your heart to be open. And maybe even open into that unconditional love for yourself. Being kind to yourself. When those thoughts come through that aren't so kind, let them stop. Let them go. And just be with that unconditional love. Shoulders, arms, elbows, wrists, fingers. Let the throat soften. Let the face and all those tiny muscles notice. Let the eyes rest back in their sockets. And let the brain rest. It's so active. Just allowing yourself to rest for a moment. It only takes a few moments just to be. And then notice how you feel. It may be difficult at first. You can only do it for a couple of seconds. That's perfectly fine. In fact, it's great. Then you'll find that you want to do it a little bit longer. And then slowly, slowly feeling that breath come in and go out. And coming back gently, softly to the place you began. And again, noticing how you feel. And noticing maybe that this is how you might want to feel through this whole process. It's a journey. And a lot of times it's said, and even in like holistic nursing, it's said that those challenges, those adversities, actually when we get to the other side, we're wiser. We have that wisdom because we get to know ourselves in the meantime, possibly. It's time for us now to explore what nurtures, what heals. Because you're the one that actually, in conjunction with everything else, and integrate that healing. And Wendy, you can open your eyes if you like, and you all can open your eyes.
Beautiful, Sherry. I tell you, it's so nice to be guided because it's one thing to sit with your own mind. It does take practice and training to be able to look at the thoughts like clouds passing by and to really see the space and the pause and arrive at the present moment. But to hear someone else's beautiful voice to guide you deeper into your body than perhaps you can take yourself in the beginning is really helpful because now I have a sound that leads me away from what may be distracting me and really allows me to come into the moment. And it would have been nice to have your voice with me in the waiting room in my iPod or such. And that was really lovely and healing, and you got me right into that zone really quickly.
Thank you, Wendy.
And I hope for all of our viewers that they're able to take something from this today, this small practice that we just did, to apply it with whatever they're going through to help ease what's going on. I know when I get blood pressure taken and I'm talking to the assistant taking my blood pressure and I didn't take time to center my breathing, my pressure comes up higher, and if I don't like the number, I ask if we can do it again because it always shows up after I do a breathing exercise for just maybe 45 seconds seconds to a minute, I'm able to get the blood pressure down just a little because I've eased into the moment as opposed to what's coming next. So it's reminding me of the applications as a practitioner, putting that into play during all this healing. So Sherry, any takeaways for our audience in holistic healing, working with the whole person in an integrative approach? We're not talking about doing things outside of your medical oncologist, your breast surgeon. This is the whole person, working with your oncologist, your breast surgeon, your doctors, to make sure that this all works in agreement with the treatment plan. So is there a takeaway that you would like to give to our audience, a summary of what we've chatted about today?
I think the biggest thing is to, again, know that you're not the cancer. It's a diagnosis, but it's not you. I remember a yoga student coming in and saying, you know, I don't feel like myself. And I said, I understand that. But I said, you are. You are still you. And that's something I think to remember. And I think all of these integrated therapies help us remember who we are. I think that's first off. And then again, the breath is always with you. You can use that anytime, any place. Just stop for a moment, feel your breath come and go, because it's proven again that it really stops all that activity, that fight flight, right? Because the minute we start thinking about the future, we get anxious, we worry, right? And that's not good for our bodies. So integrating that body and the mind together, because the mind has a lot of control, and we can actually not control the mind, but we can actually negotiate with it, right? And then the spirit. Nurturing that spirit within you is huge. You know, what you believe, what your faith is, nurturing all of that and finding for you, again, what builds you up. You know, not the negative talk in the brain and the mind, but what really nurtures you. Family, friends, spending time. Don't worry about what, you know, what to say or what, and hopefully for them not to, you know, worry about what to say to you, but just be you. And then it makes that situation much easier. So as you go along, preventive, dealing with the disease, whatever it is that you're working with, work with it in that holistic approach. And know that you're not alone, that's first off, and that you always have that inner essence of your being that's there with you. And you can count on that. Trust that, and you'll know. Find
Beautiful.
something for you to nourish again, whether it's yoga, tai chi, whatever resonates with you. We're not all the same. So you'll find something for you that is in the long run gives you that sense of well-being, because that's what you want, that sense of well-being.
Absolutely. I want to thank Breast Cancer Answers for allowing this to be a labor of love for us on this side, and to have our board certified holistic nurse, Sherry Zumbrunnen, in this morning to assist us in her wisdom and healing the whole person. Thank you so much, and have a beautiful healing day. Be well.
Thank you. Bye-bye.